Today's guest on The Grueling Truth is Dr. David Geier, and he is the author of That's Gotta Hurt, The Injuries That Changed Sports Forever. So what inspired you to write this book?
Well, I as a lot of people that work in my field were, I played sports growing up. I can't say I was a stellar athlete by any means, but loved playing different sports. And so as I get into orthopedic surgery and sports medicine, I kind of realized that one of probably the best thing about orthopedic surgery is being able to tell active people, being able to tell athletes that they're cleared to get back to play after an injury. They get so excited. And so I wanted to show what's been changing at the pro and college level, good and bad, that affects kids that play these sports and certainly adults that like to stay active.
You had a wide variety of athletes and injuries in the book. How were you able to have so many diverse injuries and on the topic?
I think a lot of it is just things that really impact, athletes in all sorts of different sports. And there wasn't, just like, what I do, orthopedic surgery is bone and joint surgery, but there's so many other injuries and really hot medical topics like sudden cardiac death and heat stroke and some of these things that are a little bit outside of orthopedic surgery but are really important to maybe youth athletes or, again, adult weekend warriors that I thought were important to discuss.
The amazing thing, I was Googling and learning about the different sports injuries and all, and they had a list of the most serious sports injuries of all time. And the crazy part about the list that I found, unfortunately some of the athletes had died. And that wasn't considered the top sports injury, which just baffled me. I would think that would be the most severe injury.
Yeah, I would think that if you lose your life, that's more severe. Even if you just break your leg and need surgery, I would think that the death would be more serious. I'd love to figure out how they decided severity there.
Exactly. I mean, I would figure the list would be death, then paralyzation, then, whatever else after that. But obviously, those would definitely be the top two, I would think.
Yeah, the head, spine, and then obviously anything that kills you. I think that certainly counts.
Mm-hmm. So, how are you able to do all these things that you do? You have your own podcast. You write for an insane amount of people, it seems, and you're always doing media. How do you find the time?
Yeah, it's challenging. You kind of work your schedule in a way to try to be able to do other things. You do it, nights, weekends when you can. Like in the case of the book, that was a lot of weekends and a lot of research at night and things like that. But if you really care about, getting the message, out, talking about injuries and treatments and surgeries in language that the lay public can understand, which obviously I do, then you find time for it.
Definitely, and then all the committee work that you do, giving back to the community. So most of those committees, I would assume, focus on ways of preventing injuries.
Yeah, I mean, a lot of it is education of other orthopedic surgeons across the world, and then, like you say, parents and coaches. A lot of sort of outreach efforts online and through various publications. Yeah, so I mean, a lot of it is really about giving back. I mean, if we can, it's always great to come up with new treatments, new surgeries for these injuries. But if you can prevent some of them from happening in the first place, that's much, much more important and much better. And so I think that is really one of our goals.
Exactly. An ounce of prevention is worth a pound of cure, that kind of thing?
Yes, absolutely. I mean, you're not going to prevent every sports injury by any means. We try to make the sport safer. We try, with rules changes and equipment and all this stuff. We'll never prevent them all, but where we can make some dents in the injury rates, we absolutely need to try.
What do you feel are some of the best advancements in the equipment changes?
I think that the helmets in a variety of sports, not just football, have gotten a lot better and have significantly decreased the rates of injuries. No helmet can prevent every concussion, but they certainly can prevent some. But we clearly have a ways to go. I mean, we've got, a couple pitchers in baseball every year getting skull fractures or facial fractures by getting hit by a line drive, and yet we don't have them wearing helmets. We saw in cricket, Phillip Hughes, which is not a common sport here, but a big name worldwide, died from getting hit in the back of the helmet right below the helmet, ruptured his vertebral artery, and led to bleeding in the brain, and he died. So helmets are good. There's certainly always room to improve, but they can also never completely eliminate the risk of serious injuries.
Have you got to see the new helmets they have in, I want to say it's Georgia Southern or not Georgia State. I want to say Georgia Southern. The Panthers, where they have, it looks like the interior of the helmet on the inside, but they also have it on the outside.
I haven't seen that one specifically. I know that there's a number of helmets being tried, and there's one that a number of colleges, and maybe this one, a number of colleges and some pro teams are going to use this fall that have sort of multiple layers of shock absorbers of different types and in different directions, and it really kind of fits right onto your head without the ability for your head to rattle around inside the helmet. What we don't know is, no matter how good the helmet is, how much does it lower the risk of concussions? And that obviously remains to be seen.
Have you ever followed the LFL by chance?
I have not.
Oh, okay. The LFL used to be the Lingerie Football League, and now it's the Legends Football League. And you mentioned about advances in uniforms. And one of because they wear hockey helmets to play football. It's the dangest thing.
That's interesting. There's a lot of debate about helmets, just conceptually, with people that say that part of the problem that football has is that the bigger, the stronger the helmet, the more fearless the players are, and then they play more dangerously. That if it was the leather helmets back in the 50s and 60s, players wouldn't be launching themselves at other players, and obviously that's something we can never test, but it is an interesting phenomenon that the helmet in some ways can be almost too protective.
Exactly. Yeah, if they feel like they're invincible with it, I know what you mean. That they'll just go out and do anything. And you're right.
Absolutely.
Yeah, because that's one of the two issues with that sport is the helmets, which I think are interesting. They have the hockey helmets, and then the other one is they are going to finally get pants next year because the turf burn, you can imagine, is crazy high in that league.
Yeah, that actually makes sense. And that artificial turf, even not the old school artificial turf, which was basically turf on top of padding on top of concrete. This is sort of the infill turf surfaces that a lot of the NFL teams have. That can still, just really tear up your skin. That's why the U.S. women's national soccer team was so opposed to playing in Canada, because it was going to be the artificial turf and what it does to their legs. So that doesn't surprise me, actually.
Oh yeah, it's just amazing how some of the small things really add up in sports injuries. What do you feel some of the better recent advances in prevention are?
I think we've gotten a lot better, especially with, say, like ACL injuries. We've got exercise programs, and I write about this with the U.S. women's national team and Brandy Chastain, and how common ACL injuries are for female athletes. We have exercise prevention programs now that you do as part of your warm-ups every day that can really lower your risk 40 to 70%. And if I'm a parent of a son or daughter that plays soccer or basketball or volleyball or football, I'm absolutely, going to look at having them do one of these programs every day, as an athlete in their young ages to try to lower that risk.
Exactly. Just working on that stuff ahead of time, it'll make a huge impact. I agree with you 100% there. Speaking about preparing ahead of time, have you ever done any research into like James Harrison of the Pittsburgh? How just the amount of stuff that he does going into it with having the sleep deprivation chambers and the oxygen chambers and the professional chefs to get them the proper food. Do you feel that those type of things really impact?
I guess my answer would be I don't know, but I know a lot of teams are very quietly researching that. They keep it quiet for a competitive advantage, but they have players wearing all these types of monitors. I mean, in fact, I'm wearing a Whoop monitor, which the Major League Baseball players wear and the NBA players wear anytime except for games to test recovery. I think the hyperbaric oxygen. I mean, there's all sorts of things being tried to help these guys recover. I think generally the concept is amazingly important. The question is, we're getting all this data from all of it, and we're still kind of at the beginning of really knowing what all that data means.
So, how do you feel the best way to utilize that information they're getting is? I mean, do you feel that implementing as much of it as possible right away, and then gradually getting rid of some of it? Or do you feel that to gradually add more of the new ideals?
Well, I mean, it's really an interesting thing. I mean, I generally think that all of this stuff, that with the GPS and the accelerometers that can detect motion in different directions and try to figure out injury risk is absolutely important. The question gets a little bit to, you're sort of opening a Pandora's box. Like, what does the team have the right to track outside of practice and outside of games? Should they be able to tell how much you're sleeping, or are you out at a bar at 2 a.m? I mean, I think there's some sort of ethical questions that come of it, but I'm for anything, generally, assuming it's legal and ethical, I'm for anything that helps us help players recover from the damage of these sports.
Speaking about, like you were saying about ethical and the team's access to player information, do you feel that the team being able to prevent drug or alcohol or other substances is violation of their information, or do you think that that's they should be allowed access to that information to prevent injuries and
I'd say that's really a great question, and most of that is bargained in the collective bargaining agreements between the players' unions or players' associations and the owners. I think that it's really tricky. I mean, I'm a huge fan of privacy. I'm a huge fan of kind of maintaining doctor-patient confidentiality, and it's really just between the athlete and the doctor. But I think it is tricky. I think rather than saying, hey, we have to know where you are 24 hours a day, my first thought would be we do everything we can to educate them and hope that that's enough. I will tell you that from what I hear, and this is sort of anecdotal, but you hear from these companies that do these recovery technologies and things like that alone seems to help players drink less. It seems to help players not stay out as late and get more sleep. So I think that's where I think I'd start with the education and then figure it out from there.
Continuing along those lines about teams and what they need to know, the whole Chris Bosh situation, where he seems to be, the team and everybody's aware of his medical condition now, but if he feels that he is able to play, do you feel the team should be able to step in and say no because we're worried about liability?
It's tricky, and I've talked to a number of people about this. The team is under no obligation to play him, and not just him, anybody that's got some medical condition that they're concerned about. The flip side of that is if he can get doctors to clear him and find a team that is okay with that risk, then I have no problem with him playing. The blood clots are a tricky issue because those blood thinners have complications with bleeding, and so most doctors, and I actually wrote a newspaper column about this when it came up, a lot of doctors are fine with certain sports, but especially somebody that's had multiple blood clots, I think that they get very concerned about contact and collision sports like basketball. So that's one that I don't know. I'm not in the NBA, but I think that I'll be a little surprised if a team takes a chance on that. Maybe I'll be wrong. I hope I'm wrong. I'd really love to see him play, but I think the teams would be very nervous.
Yeah, because that's one of those confusing things where it's if the team has the rights to him, but they refuse to let him play, then should he have the right to be able to look for other teams, or if they have the legal right to keep him, should they be allowed to block him from being able to do his his sport of choice? It's
Right.
Yeah.
It's tricky. Usually they negotiate that separately. They negotiate sort of a buyout or something like that and work all that out. And I think that'll happen here. But I don't know what's ultimately going to come of it.
So what are some of the major injury preventions that people are working on nowadays that we should know about?
I think the one that kind of ties in the advancement in treatments, but things that also ultimately may help preserve our bodies long term, are this question of PRP, the platelet-rich plasma, and the stem cells that the pro athletes have really brought into the public consciousness. Should we be trying these sort of unproven treatments that may help things like arthritis reverse and may help chronic muscle and tendon injuries that nothing is seeming to work? If those turn out to be a major breakthrough, that's going to be a major advance. But right now, we can't definitively say that they're going to work, and insurance doesn't pay for them. So we're asking patients to pay a lot of money out of pocket for something that we don't know works. But again, a lot of people want it because the pro athletes are getting it. So it's sort of a really delicate balance in terms of these experimental treatments to try to preserve people's bodies.
So what would if one of your patients came in and said, "Hey, I've heard about this new treatment," what would you tell them about if they should proceed with it or not?
I think you tell them, hey, that this is what it does. This is the pros. These are the cons, and a number of people that we've done this seem to get good relief, but the studies are still sort of early, and we can't prove that it's definitely going to work. So there's a chance that you may get this treatment and you may not feel that much better. But if it does work, it potentially helps you avoid surgery. And so you sort of put it in these are the pros, these are the cons, and let people make their own decisions.
I was going to say, the nice thing is with the pro athletes and them being able to test these out, like you mentioned, the cost is high, but fortunately the ones in the major sports, either the team's willing to pay for it or even if the athlete has to pay for it, they're being compensated at such a level they can afford it, right?
Well, I'm sorry, you were breaking up on me. What was the answer to that?
I was saying, with the athletes being able to afford these new treatments, is it a better way for them to be able to test them so the general public can learn about them, or do you feel that
the cost is no issue for the pro athletes for sure. I think that's one way to look at it. What we really need are sort of these randomized control studies where one group of people gets the procedure, one group gets sort of a control procedure like a saline injection, and then you follow them for 6 months or a year, and you really see the benefits. It's hard when you just do, all right, we did this injection on 10 athletes, and they all seem to do great. Was it a placebo effect? Was it, who knows? But I think that's what we really need are these bigger studies, and they're coming. We just, again, this is all still really early.
Is it possible that athletes are able, just because of their conditioning, would be able to recover better than, say, the normal public?
I think that they have access, pro athletes have access to physical therapists and can work with them not just every day, but hours every day, and they have athletic trainers, and they've got really the time to do it. But I think that the average public can take some of that and do it as much as they can themselves. Go to physical therapy after a surgery. Make sure that you don't come back too soon. Work back into sports slowly and cross-train as you come back. I think they can take some of what athletes do to help their own recoveries.
If somebody who's listening wants to learn more about the topics in your book and wants to learn more about injuries in sports, what would you recommend for them?
I think obviously I'm a big fan of the book. I think it tells you a lot about not just pro and college athletes, but adults, their injuries, people that just love to play sports and be active, but also the injuries that affect our kids. I think there's a number of different other websites. The Sports Medicine Societies put out good information, and certainly you're welcome to check out my website at any time, drdavidgeier.com. But I think just educating yourself as much as possible is always a good thing.
Excellent. So if they're wanting to get a hold of you to ask you questions about these topics, like you said, your website, and then do you do any social media?
Yeah, I'm on Twitter and Facebook. Everything is at Dr. David Geier, or that suffix, Dr. David Geier, and Geier's Geier. Yeah, YouTube, Facebook, Twitter. I'm active on all of those. And then I have a contact form on my website. I'd love to interact with people at any point.
Excellent. Thank you, sir. We greatly appreciate your time today covering your book, and that way more people can learn about sports injuries and how to prevent them.
Yeah, I really appreciate it. I'm really glad. Thankfully, you had me on, and I hope it helps a lot of people.
Excellent.